Tánaiste, unlike you, I'm not medically qualified, though I have spent a number of years in the healthcare area working around medical devices and medicines. And because I'm not expert, I talk to experts to try and inform myself of what is happening on the ground. And when I say experts, I mean those who are at the front line of medicine, those who are at cutting-edge medicine and those who are at the front line of dealing with COVID patients. On the 4th of April 2020, I put out a national statement calling for the use of face masks. This was not supported by NPHET until August 2020, when they mandated masks in shops and indoor settings. On the 23rd of April, I asked NPHET to consider having senior nursing staff in residential care settings take nasal swabs rather than sending in National Ambulance people in full PPE terrorising dementia patients. I asked for it in April. It did not become policy until the end of May, waiting again for NPHET approval. In May 2020, I brought antigen testing to NPHET, along with a company, a world-leading pharmaceutical company, to deal with it, and it was dismissed out of hand within 2 days. I pushed it through your office, through the Taoiseach's office, through the Health Department. I looked to get pilots done with CIF, and I engaged with Professor Paddy Mallon. And in fairness, Taoiseach, to you, you looked to get Professor Mark Ferguson on board because you saw the resistance to antigen testing. And here we are now talking about rollouts of some pilots in August or September this year. This is not acceptable to me, Taoiseach, when it's being used in the US, when we're using it as a Brexit mediator in terms of haulage. So we're still trying to roll it out, and this is all retarding our COVID response. In recent weeks, the Health Committee have produced a report, a very fine report, on the use of and the possible benefits of supplementing vitamin D, which there is overwhelming evidence to do this now, Taoiseach, and yet it has not been adopted by NPHET, has not been properly looked at. And this is really a very benign prophylaxis that could be used, and I can't understand why we're not doing it. And I would think NPHET still refuses to take seriously the views of the underlings in the healthcare service, which they need to do. And I ask who are making the decisions, Taoiseach, and I can tell you there are people who are on many times the industrial wage in this country, and they are not furloughed from their jobs or from their businesses. I would also ask you, Taoiseach, to look at the issue of e-health in this country. We do not have a patient identifier number. We had the farcical situation recently in healthcare where we have two systems, one in the acute hospitals department, one in community health, which don't talk to each other, and therefore we have double booking of people coming for vaccinations. This is not Ireland in 2020, nor should it be. We need to look at Slovakia, Denmark, Hungary, in terms of what they are doing, and we need to send people out there to find out what e-health systems they are using, Taoiseach, and bring this into our COVID response.
Thank you, Deputy Shanahan. Tánaiste.
Thanks, Deputy. I think you make some very good points, but just at the outset to say what I think Denmark has had a very good response to the pandemic, and is one of the few countries in the European Union, one of the few countries in the world, certainly in Europe, that has a lower mortality rate than us. I'm not sure we'd be following Slovakia or Hungary in terms of their response to the pandemic, because their mortality rate, sadly, is among the highest in the European Union. I think Deputy Shanahan is absolutely spot on in relation to e-health. A real deficiency in our health service is the fact that we don't have an individual health identifier. We have a really good PPS system in Ireland and a really good public service card in Ireland. For lots of reasons, that hasn't been extended or replicated for health, and I think one of the outcomes and dividends from this pandemic has to be exactly that: universal patient registration, everyone having a health ID, and therefore we can do things much better in terms of vaccination programmes, screening programmes, and also we'll be able to identify people through disease registers and so on. And I think what he says in relation to that is spot on, and will have to be part of the legacy and dividend from this pandemic.
Thank you, Tánaiste. Deputy Shanahan.
In terms of Denmark and Hungary, I was speaking actually about their e-health systems, Taoiseach, rather than their mortality rates. I think you referenced in terms of PPS numbers. My understanding is that we have up to 20% more PPS numbers in the state than we have population. And I think, therefore, this beholds on us now to come up with a new identifier number to try and manage our systems. Also, as you're well aware, there have been issues for years in terms of the hospital inpatient data, the HYPE systems, which we suffered from in University Hospital Waterford for years, which the underreporting of our cardiac activity in terms of national HYPE data. So I would ask at the end of this exercise, and not even at the end of this exercise, but as part of it now, Tánaiste, that we take a really serious look at in terms of integrating technologies and integrating communication systems so we can provide a better response nationally in our hospitals, in our primary care settings and for our patients. And as you say, we will have spent an awful lot of money. We need to have something at the end of this, and I hope that government will deliver very shortly some initiatives around new health ICT systems. Thank you.
Thank you, Deputy. Tánaiste.
Thanks, Deputy. Both Taoiseach and I feel very strongly about this, not least because we're both former health ministers and understand some of the problems that health administration faces, and we're both keen that some of the European Recovery Fund, we've about 800, 900 million coming to us from the European Recovery Fund, and we want a decent chunk of that to be used for e-health to do exactly some of the things that you suggest. I should say, though, there are lots of things that have happened in our health service in terms of e-health that have worked very well. You know, we do have a very good patient record now in maternity care. I believe we have something starting in paediatrics. We have Medalist, which is a lab system, so that people don't end up having to have the same blood test twice. We have a good system now in terms of radiology. It moved from PASS to NIMIS, I think. So I wouldn't like the impression to be created that nothing has happened in this space, but it is true that not enough has happened. I'd very much concur with the Deputy's view that we need to up our game and invest in this. While people might have been scared by the experience of PPARS, the very expensive health service system that went horribly wrong 10 or 15 years ago, that shouldn't allow us to make the mistake, therefore, of not investing in e-health when we need to.